some parts of advanced wound care modalities. Part of them will be explained بعد كده على طول في يعني من اي ام اس وحاجات will explained من دكتور مصطفى من اي ام اس. الفاك ثيرابي، الكونسيبت اوف نيجاتيف بريشر ووند ثيرابي ده كونسيبت يمكن around more than 20 years now 20 more years. انت بتغير على الجرح ليه؟ الاول خالص عشان الهواء، انت بتغطيه. طب لو الجرح ده ما بيشوفش هواء، no need for frequent dressing up to 3 days 4 days بلس النيجاتيف بريشر والستيموليت ذا ووند، يبقى فيه انزيماتيك يشال كل البليسز الموجوده مع الادفانسز بتاع المكن بتاع الفاك دريسنج والنوع الدريسنج ابلايد بقى دلوقتي. دي ذا ساينس يعني الماشين ذا بارت dressing of the part, preparation of the bed of the wound, another part. But consider the negative pressure is going for very difficult wounds. يعني احنا I'm using it liberally في العيانين after foot surgery. المالتيبل تروما we worked في as a trauma surgeon before، بس انا عارف ان دول الفاك ثيرابي وهيبقى في بارت على الفاك ثيرابي لوحده. how vac therapy promote wound healing يعني. Normally with healing, skin will go outside, فالwound will become bigger. If you take it inside, the skin will come closer. تلاقي الجرح بيصغر بيكش. Provide complete bed wound contact. bed wound انت ممكن تحط سيلفر وممكن تحط كذا حاجة ممكن يتحط يعني. that distribute the negative pressure all over the wound. abdominal wound كبير، تروما في الثاي، حوادث، سترنوتومي، هيقلل الإديمة. using it في العيانين بتاع الانفديمة مثلا was very difficult to heal. vac therapy with some people is going a good results. يعني في حد من زملاتنا قدم في ألمانيا من كام شهر بيبر على الفاك ثيرابي في الانفديمة يعني كانت very impressive. when to use it early post operative after tooth amputation after food extensive debridement. هي built with experiences. البيبرز اللي موجودة the papers of results not a technique. هنا بتفرق شوية. النوع الفوم اللي هيستخدم دوت is it foam or gauze، لكن في النهاية negative pressure wound therapy or vac therapy ده واحدة من الحاجات اللي هي can be used after extensive foot surgery.
ACI Basic Vac Dressing Application. The VAC therapy system is indicated for patients with chronic, acute, traumatic, subacute, and dehisced wounds, partial thickness burns, ulcers such as diabetic, pressure, or venous insufficiency, flaps, and grafts. This video is intended for clinicians. Prior to use of the VAC therapy system, consult detailed product instructions and important prescribing information contained in the KCI VAC therapy clinical guidelines and the device or disposables specific user's guide. Additional safety information specific to the VAC therapy system is available at the end of this video. Contact your local KCI representative or call 1-800-275-4524 if you have any questions before initiating therapy. If you are performing a dressing change, be sure to identify the number of foam pieces previously placed in the wound. Ensure that you remove all the foam pieces. VAC dressing application. Assess wound size and type. Cut dressing to appropriate size. Do not cut dressing over wound, as this could result in foam particles falling into the wound. Gently place dressing in wound without overlapping onto intact skin. Note the total number of pieces of foam used in the wound. VAC drape application. Measure 3 to 5 centimeters from border of intact skin. Trim VAC drape to size. Retain blue handling tab on portion of vac drape used. Peel back one side of layer 1. Place adhesive side down over wound. Remove the remaining side of layer 1. Remove green striped stabilization layer 2. Remove perforated blue handling tabs. SensaTrack pad application. Identify SensaTrack pad application site. Pinch drape. Cut at least a 2.5 centimeter round hole. Do not cut a slit or an X as it could self-seal. Remove backing layers 1 and 2 from SensaTrack pad. Place SensaTrack pad opening directly over hole in drape. Apply gentle pressure to secure. Pull blue tab to remove stabilization layer. Connect SensaTrack pad tubing to canister tubing and open clamps. Count and note the number of foam pieces used in the wound and document on the supplied foam quantity labels on the VAC ruler and in the patient's chart. Record the date of the dressing change. The foam quantity labels can be peeled off and placed in an area that can be seen by the next treating clinician. For example, around the SensaTrack tubing, on the VAC drape, and in the patient's chart. Turn on power to the VAC therapy unit and set to the physician-prescribed therapy settings to initiate therapy. VAC therapy is contraindicated for patients with malignancy in the wound, untreated osteomyelitis, non-enteric and unexplored fistulas, and necrotic tissue with eschar present. After debridement of necrotic tissue and complete removal of eschar, VAC therapy may be used after hemostasis has been achieved. VAC therapy foam dressings should not be placed directly in contact with exposed blood vessels, anastomotic sites, organs, or nerves. Patients with sensitivity to silver should not use the VAC Granufoam silver dressing. Do not place any foam dressing into blind, unexplored tunnels. The VAC white foam dressing may be used with explored tunnels. Instructions for use and safety information. As with any device, it is important to read and understand the detailed instructions for use and safety information, including information on bleeding, exposed vessels and organs, and infection, applicable to your VAC therapy unit and dressing application that can be found within the therapy unit, disposables carton, or in the VAC therapy clinical guidelines. www.kci1.com. These sources provide information concerning the proper application of all VAC therapy dressings, including advanced